In today's video, we discuss what you should expect during the placement of your labor epidural. Hey guys, and welcome back. Dr. Bobby here again, your board certified anesthesiologist, and you already know, on this channel we discuss all things education, motivation, and personal finance delivered to you in an easily understandable and relatable fashion. I have been practicing anesthesiology for the past 7 years, and I gotta tell you that I have encountered a lot of women who have severe anxiety surrounding the laboring process and the act of having a baby. And my primary motivation for wanting to do this video really stems to provide those people with information such that they are empowered during their experience. Now, I don't represent every anesthesiologist out there, and of course what I have to say may be a little bit different depending on where you are, but for the most part, most anesthesiologists pretty much operate in a very similar fashion. So if you're in the United States, more specifically, you can pretty much expect things to go around about this way. Once you have been admitted to the labor and delivery area and it's been determined that you are indeed in active labor and you're uncomfortable, obviously, you give your nurse a call, she then calls me, and then I come running. Now, typically before I get there, the nurse has already done a few things. She's already drawn blood to ensure that we have a complete blood count so that we can ensure that you're not at an increased risk of bleeding, which would be a contraindication to actually placing the epidural. And she's already inserted an IV line and giving you some hydration, which is also super important because epidurals can make your blood pressure a little bit lower. And don't nobody like that. So typically once the anesthesiologist gets there, they will start by doing what we call a history and physical examination. Basically, in layman's terms, what this means is they will start to ask you questions about your pregnancy. They'll ensure that you don't have allergies. They'll go over medications with you and really just kind of get a sense of where you are in the process and to ensure that you actually meet the criteria to get an epidural. After getting a pretty accurate history and physical examination, the anesthesiologist, they will start what we call the informed consenting process. Informed consenting is, in layman's terms, is basically when we talk about exactly what the procedure entails and we get your permission to actually proceed. My informed consenting kind of goes like this. Basically, an epidural is a way in which we control your pain. It takes that 10 out of 10 pain that you otherwise feel down to about a 2 or a 3, makes it a lot more manageable. It's important also to remember that the epidural is not designed for you to be paraplegic. It is designed such that you are able to handle the pressure that comes into your pelvis as you continue to dilate. Once you're dilated and you feel that pressure, you will then have a nidus for which to push towards and to get the baby out. So following giving a bit of a spiel in terms of what patients can expect, we go through the consent form and we get permission from the patient to proceed. So after all this paperwork's done and we're all ready to go, your nurse is instrumental in ensuring that you're in the appropriate position to proceed. The biggest thing I can tell you in terms of ensuring that you do the absolute best to get the epidural in quickly is to really curl around the baby. What you want to do is to create a C with your back so that you're opening up those spaces. That's where I got to get with the epidural needle. That's going to make this a lot quicker for you. After we got you in a good position and I felt your back and we clean your back off, we create a sterile field with the drape. We then give you the big pinch. Basically, the big pinch is the lidocaine or the numbing medicine that we use to ensure that when we actually place the epidural needle, you don't feel it. Typically, you feel that stick and a burn for about 2 or 3 seconds, and then following that, you don't feel anything. Once we've got the skin good and numb, we then place the epidural needle. Typically, most patients describe this process as feeling like a pressure sensation. Assuming you have a pretty straight back, you don't have much in the way of scoliosis or a curve in your spine, and you otherwise have a body habitus that's pretty easily amenable to doing an epidural, epidural normally takes about maybe 3 or 4 minutes. After we've reached the epidural space with the needle, we obviously have to have a conduit through which to ensure that you remain numb for the duration of your labor. This is when we thread what we call an epidural catheter into your back. The epidural catheter is your friend. This catheter is basically a tube that goes into your back, into the epidural space, and is the way in which we are able to give you the local anesthesia or the numbing medicine that keeps you comfortable during your labor process. After we get this epidural catheter in, we're all relieved. You're relieved, and I'm certainly relieved. But we're not done yet. After we got this catheter in your back, the next thing we have to do is to ensure that it's in the right place. You want that. So the way in which we ensure that the catheter is in the right place is we basically give you a bunch of numbing medicine that has some epinephrine in it. This ensures that the catheter is not in a blood vessel. So after we give you some of this medicine, we make sure that you don't have an increase in your heart rate, that you don't have a funny taste in your mouth, that you don't have any sort of numbness around your mouth. All of these things would be a positive sign that the catheter is in a blood vessel. Then we'd have to take it out and start over. Assuming you don't have those things, we move forward, we secure the catheter, and we hook that catheter up to a pump that provides you with local anesthesia that continues to make you comfortable during the entire duration of your laboring process. So it typically takes about 10 to 15 minutes for the epidural to really peak in effect, but you're going to start to notice some changes really after about 5 or 6 minutes. These changes include warming of your legs on both sides, pins and needle sensation in your legs. And the most important, you will notice that the duration of each one of your contractions will continuously get shorter and shorter and shorter, and you're gonna feel better and better and better and be happier and happier and happier. You see where I'm going with this, right? So meanwhile, while all of this is going on, your nurse will have already attached a blood pressure cuff and started to cycle your blood pressure pretty frequently, normally around every 3 minutes. The reason why we do this is because once we start to give you that numbing medicine through the epidural catheter, you basically can become hypotensive or have a lower blood pressure. So in the interim, we're obviously giving you more IV fluid, and we have the ability to give you medications that can raise your blood pressure if you have a lower blood pressure during this time. Once the epidural is all secure, the nurse takes her time and she ensures you're in a good position for the epidural to spread appropriately. Normally, that's what we call the left uterine position. Typically, babies don't like for moms to lay on top of their major vessel. So you may notice that your nurse kind of tilts you to the side a little bit. This is normal. And there you go. After about 15 minutes, you are singing my praises and you are super happy that you've actually gotten this epidural. After you're all laid down and getting more comfortable, we then hook that epidural catheter to what we call an epidural pump. This pump is your lifeline and your friend. Basically, this pump will administer a certain amount of medication every hour without you having to think or do anything. Typically, it's set in such a way that you don't really have to think about it, and you're able to lay down and take a nap and be really happy, and then wake up, push the baby out, and be great. We also try to make sure that you have some control over how numb you want to feel. So we give you a button to be able to press to give yourself additional doses of medication if you so desire. Now, don't worry, we've taken all the liberties to ensure that you will not overdose yourself. So feel free to press that button 1,000 times. You'll only get 3 doses. Typically, by the time your anesthesiologist leaves the room, you are super happy. And you are singing their praises, and they feel great because they did a good thing for you. Listen, I hope you enjoyed my quick explanation as to what you can expect during your labor epidural. And by no means is this comprehensive, but listen, go down in the comments. Let's have a quick conversation. Tell me about your epidural experience. Let me know how it was. Was it good? Could it have been improved? I mean, you know, we only can improve it if we know about it. So why don't you go down there, let's have a conversation, and listen, catch me on the next video. If you like our content, please feel free to like, share, and subscribe. Otherwise, I'll catch you. Peace.